Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And on that very note, we're going to talk today about one of our patients. Her name is Carrie. She's 59 years old and she underwent full facial rejuvenation with me. And we're going to break down her case step by step and follow her through her entire journey. This is a real treat and a pretty rare inside view of what the entire process actually looks like. We're going to talk about her motivation. I'm going to break down the anatomy and the thoughts behind the particular procedures that I recommended in order to get that beautiful rejuvenated result that we all want, as well as we're going to look at her healing process, how she feels about the final outcome, and of course, what the final outcome looks like after 3 months of recovery. So without further ado, let's break it down. So as mentioned, Carrie is 59 years old. She's a successful entrepreneur and business owner in Los Angeles area. She runs a beautiful boutique interior decorating store. And one of the things that she noticed, like everyone else, is as time went on, she stopped looking like herself. There becomes a gap, a widening gap between the way you look and the way you feel about the way you look. In fact, for most people, we're kind of stuck in our 30s and our facial aging changes start to get away from us and suddenly we become unrecognizable. And when you really break it down, you understand that people age in a very similar way. And when we look at Carrie's concerns, even though she didn't come in specifying these particular things, she just knew that she's no longer looking like herself and looking older and didn't like taking pictures as much and didn't like to be in front of the mirror as often. And when you come in with those concerns, that's where I get involved and start looking at the components that make up the aging changes. And to put it very simply in a systematic way, it comes down to 3 categorical changes. There's the changes that are happening to the skin, there's changes that are happening to the volume of the face, which is basically the fat in the face, and there's changes that are happening to the fascia. And what's happening to each of these 3 areas are very predictable and very constant. Skin changes come down to changes in fine lines and wrinkles, they come down to changes in discoloration, they come down to changes in dehydration, texture, and lack of luminosity, or basically dullness. When you look at the volume changes, as the facial fat begins to diminish, you start to lose the overall fullness of the face, and that leads to a deflated, hollowed out look, which makes you look tired. Then this 3rd category is the changes that are related to sagging. What things start to sag? Well, the corners of the brows start to sag, the midface, the jawline, and the neck all start to sag. The eyelids start to sag. You start to get excess skin around the upper and lower eyelids. You start to see bags under the eyes. You start to see an elongated upper lip. These are all sort of constant aging changes that are happening to the entire soft tissue of the face. So whenever I see a patient, I look at them in these 3 categories and I try to identify which of the components are involved in each particular phase. And as a result of that analysis, we put together a plan. So let's take a look at Carrie in more detail. So when you look at Carrie, you start to see the typical changes happening to the facial skin. You start to see fine lines, wrinkles, discoloration, overall lack of luminosity and increased dullness. Those are the changes that we are going to address specifically in her case with skincare. And I'm going to talk more about that in a moment. Changes that are happening to her facial volume. You can see that there is a loss of volume under her eyes. You can see that the upper brow area has deflated. The temples have lost some fullness. You can see that the lips and the areas around her chin has lost some fullness. These is all from deep fat pads beginning to diminish as time goes on. Then you look at the sagging changes. You take it from the top and you see the lateral brow starts to sag. The mid-face starts to sag. You start deepening of the nasolabial folds. You start to see the jowling present. And then you look at the neck and there's a heaviness and banding of the platysmal muscle as it starts to wear down and pull away from the upper face. So when you look at all that together, you see that the overall face becomes elongated. It starts to take on the shape of more square or rectangular. Then you look at the central face and you see that there's extra skin in Carrie's upper eyelids, there's extra skin and fat in her lower eyelids, and then there's an overall elongation of her upper lip and a thinning of her red lip or her true upper lip. When you look at all these things together, you start to put together a plan. As I mentioned, for Carrie's skin, we're going to treat her with a trifecta, which is a all-in-one skincare program that I developed, which basically was designed for my post-operative facial rejuvenation patients just to make life super easy and get them on all the active ingredients they need to turn the skin around. Then you look at the volume changes, and with that I use fat transfer. And in Carrie's case, we put a little bit of fat under her eyes, we put a little bit of fat above her eyes, we put a little bit of fat in the temples, lips, and around the mouth. Never to make the face look full, but just to make the face look more refreshed. Now, the key to the whole outcome, the sort of hero of the entire overall rejuvenation, comes down to repositioning of the soft tissues and making the overall face look more like it did before. You can't get that with skin and you can't get that with the volume changes, but you can get that with the vertical restore. And the vertical restore is a trademark procedure that I developed, which addresses 4 specific areas all at once. It addresses the outer temporal region, the midface, the jawline, and the neck, and it brings everything back up into position in a more vertical orientation. It's basically what you do in the mirror when you go up like this to your face and you're like, wow, I look a lot like I did back in the day. So that is the function of the vertical restore, is to put the foundation of the face back to where it was. Then we go down to the center of the face and we, in Carrie's case, took away some skin from her upper eyelids. We took away a little bit of skin and fat from her lower eyelids, with both of them performing a blepharoplasty. And then in her upper lip, we performed a lip lift. And the lip lift basically is designed to take anywhere between 4 to 6 millimeters of length and shorten that lip and create a better proportion. Because remember, the vertical restore is shortening the overall face and reestablishing the shape back to where it was. And if we leave these segments untouched, she's gonna look out of proportion and it's gonna look strange. So that comprehensiveness of the entire outcome is extremely important in terms of creating a natural looking rejuvenation. In addition to the fact that certain techniques are done with very careful eye on how the face looks in a natural way. For example, I don't take away fat and muscle from the upper eyelid, I just take away skin. The lower eyelids, we don't change the position of the ligaments, we leave the eye shape exactly where it was. And same thing with the full repositioning with a vertical restore. Everything goes back to where it was. We don't pull horizontally, we don't pull in an unusual vector. It all goes exactly where it was. So technically, there's very important components, as well as the balancing and comprehensiveness of the overall outcome, which are key to creating that rejuvenated and fresh look. So now let's look at Carrie through her overall healing process, and she was kind enough to share with us step by step during those phases. During the recovery, the first 3 or 4 days are always the most rough looking.
This is end of day 1. I have soreness in my lip and on my eyes. I don't really feel the soreness on the side. And I have a little bit of soreness on my stomach where the suture is, where he harvested the fat. I did throw up this evening. I think I'm gonna feel a lot better tomorrow. Day 3, my eyes are really swollen today. I feel really tired and red. Day 4, I washed and curled my hair today. Feeling a little bit more normal. Waiting for the swelling to go down.
The face is going through 3rd spacing, it gets really swollen, and once you get to about the 5th or 6th day, healing really starts happening. And that healing really starts to turn the corner right around the 7th day and goes quickly up until about 2 weeks.
This is day 6. Day 6 is much better than day 5. Day 5 was kind of rough, but I feel like the swelling has really gone down this morning. My neck just looks amazing. I'm really happy with my neck. Lips are still swollen. I just have a little bit of lip gloss on today, no makeup. It's day 7. I can't believe it's already been 1 week. I have a lovely shade of yellow under my eyes, which I'm sure will be easy to cover with makeup on day 10. I'm going to get my stitches, the rest of my stitches removed in about a half an hour, and I'm super happy with the results so far.
By the time you're around 2 weeks, you look so much more like yourself and really are sort of restaurant ready, or, well, I like to joke with our patients that they're not going to go into a supermarket and scare young children, in the place. They look pretty much like a normal person, minus some, general swelling and things like that.
Here's day 10. I feel like my eyes are finally evening out a little bit today. I've always had a problem with my left eye being a little bit smaller than my right eye. And Dr. Karam was very realistic with me before my surgery, and he said that sometimes if your eye socket might be just different, there's asymmetry in everybody's face, that the eyes won't change. But I feel like it is starting to look a little bit more even. Bruising is still improving. Incision is getting better. It's day 12 and I am heading off to work for the first day since I've had my surgery, and we'll see what my employees and my clients notice today. Should be interesting. Day 15, no makeup, no filter, just standing in front of the window. Bruising's almost gone.
And then as each week goes by, as you can see, as Carrie's going through the recovery process, she just looks more and more refined, less swollen, all around looking better. But man, what a quick and beautiful transformation. As you can see, the overall healing has taken place and she just looks bright, beautiful, and literally probably 20 to 30 years younger.
Okay, it's 1 month today that I had my procedure done with Dr. Karam. Swelling is still a little bit on my left side. Bruising is mainly gone. I just have a little bit of my sunblock on my face and some lip gloss and some eyebrow pencil. You can see the discoloration underneath my eyes is finally almost gone. My scars just get better, improve every day. Hey, Dr. Karam. It's a little over 3 months since I had my procedure, so I wanted to give you an update. I was starting to feel invisible at my age, noticing that I didn't look like myself anymore. And unfortunately, ageism is real in our culture, and I decided that I wanted to invest in myself. So I had to wait a year for my surgery. And I spent that time just researching and educating myself, watching your YouTube videos almost every night leading up to my surgery. I would just watch them and rewatch them. And so I felt like by the time I got to my surgery date, I really knew what to expect. I mean, of course, I was still a little bit nervous, but I just knew that I was in such good hands because of how many procedures you do in a month. That made me feel super comfortable and confident. The comments and the reactions from my family and friends and colleagues has been 100% positive. I feel like my self-esteem and my confidence has improved, and I just wanted to thank you so much for helping me to look as young as I feel inside. Thank you, Dr. Karam. I hope that this video helps other women who are considering investing in themselves.
All right, so now we're gonna look at Carrie's before and afters next to each other, and I'm gonna kind of talk through very briefly so you can see all the different changes that have taken place. So starting with skin. At this point, Carrie has been on the trifecta for 3 months. You can already see her skin looks more bright and more glow and overall smoother. This is a consistent finding that we found with the trifecta in clinical trials, so this is not unexpected. We're very happy to see these type of changes, and they complement the other surgical changes that we've created. With the fat transfer, you can see that there's an overall softness and fullness in the areas underneath her eyes, above her eyes and her temples. The mouth looks more full and the areas around her chin do not look as deflated. This is a beautiful transition to all the soft tissue elevation that happened with the vertical restore. You can see that sharp jawline, the sharp neck. You can see the midface has been elevated back up into position with that beautiful heart shape that you can now really appreciate, as opposed to that sort of squaring or elongation that we saw preoperatively. And then when we look at the eyelids, you can see that it's free of all that extra skin. The contour and the transition between her eyelid and her cheek is much shorter and it looks a lot more youthful. And very beautifully, you can see at the level of her upper lip, the distance between her nose and her lip is shorter and the red lip is fuller because the upper lip lift effaces and brings up the upper lip, as well as the fat transfer was used to fill the volume in the lip. So when you take this all into account, you see a very beautiful, overall extremely natural, unoperated, and gorgeous before and after. And you can see from all these different after photos that she has provided us that she is feeling confident and feeling like herself, and definitely not looking like a 60-year-old. All right, everyone, I hope you enjoyed looking through that journey with Carrie. Again, so grateful to all of our patients who decide to share their entire stories and their intimate stages of healing with all of you, because I think ultimately both our patients like Carrie and myself want you to have full transparency, full understanding of what the entire process is like, so ultimately you make the best decision for yourself. But at the end of the day, as a potential patient, I want you to understand that facial surgery is obviously very intricate and very difficult, and I personally happen to have decided to make this my entire focus from a surgical point of view, and as a result, I do this literally every day. Thank you so much for your attention. If you are not currently following our YouTube channel, make sure you subscribe. If you like this content, hit like. If you have any questions whatsoever, drop them down in the comments. I'll be more than happy to address them. Send this along and share this with friends and family to let them know what is possible and help them stay on track with good decision making and empowerment so they can make the best decisions for themselves. Guys, I hope you enjoyed this. I will be presenting you with more topics like this on a weekly basis, so make sure you follow along. Until then, Dr. Amir Karam.